So for the first thing we'll be discussing is the implantation of occluder devices. So just like I was telling you guys, we'll be talking more of classification of congenital heart diseases and also their various management, that's treatments for it. Okay, so implantation of occluder devices. What are occluder devices? Okay, that's mainly what we'll be discussing about and all of that. So I have all their pictures here, you don't need to worry. So implantation of occluder devices, just so you know, it's a minimally invasive procedure. So it's used to close abnormal openings in the heart, like when you have all those atrial septal defects, ventricular septal defect, patent ductus arteriosus. You occlude. Occlude is like I'm blocking something, so I'll cover that part of the heart. Okay, so what are occluder devices? They are small, they are mesh-like structures, they are made up of metal, usually nitinol, or sometimes it's fabric. Okay, so they are designed to what? Expand and seal the defect. Like they seal, or like when you put them, they expand, then they now seal the abnormal opening in the heart. Okay, so common types of occluder devices, we have the Atrial Septal Occluders, we have the Atrial Ventricular Septal Defect Occluder, we have the Atrial Duct Occluder. So the first one, of course, for atrial septal defect, then the last one, which is the Atrial Duct Occluder, is basically for the patent Ductus Arteriosus. So what we have is a procedure is, first of all, they have to do echocardiogram, okay, to access the defect size and the location. Okay, then cardiac catheterization planning. So implantation steps is, it's actually performed in a cardiac catheterization lab under sedation and general anesthesia. A catheter is inserted through a vein and guided to the heart. So the occluder device is deployed across the defect and released once properly positioned. Okay, so that's all we have. So post-procedure care is monitor for arrhythmias, monitor for device migration or residual shunting. So antiplatelet therapy is all those aspirins, so you prescribe it for several months. Benefits is you can actually use this surgery to avoid any open heart surgery or any adverse surgeries that you might actually need to do for a heart defect later on. Then there's a short recovery time, okay, and there's high success rates. Okay, and of course it will improve all the